money on skin boosters because you're accelerating your aging.
Okay, do skin boosters cause accelerated aging? Well, honestly, you don't need to go far to search for the answer of this question. All you've got to do is a simple Google search or even a ChatGPT, and it will tell you exactly the answer, and the answer is no. Skin boosters do not cause accelerated aging. In fact, on the contrary, skin boosters promote anti-aging effects. So how do they do them? Well, first of all, you're going to get that intense hydration for a start, guys. You're going to be intensely hydrated with the injection of hyaluronic acid. You're just going to get internally moisturized. That's basically what you're going to have. You're going to have an internal moisturizer. That in itself is an anti-aging effect, because aged skin is dry skin, like really dry. I'm not talking about sort of dry as a skin type, but really dry skin. So you're going to have intensely moisturized skin that happens to be buoyant, subtle, bouncy. So that's, first of all, is an anti-aging effect. The second thing you're going to do is going to have an increase in collagen production. This is so important to understand. And why? Well, let me just take it to basics. The fact that you're getting micro injuries by the needle insertion itself, that can cause micro trauma, which then causes collagen induction. So the needles themselves going into your skin as the skin booster has been administered, that itself can cause collagen induction. So from that aspect, you're going to get an anti-aging effect. Now that we've got this out of the way, let's dive a little deeper to see why do people go for skin boosters, and why should you even invest in a skin booster, and are they really worth the hype? Well, let's start with, first of all, what are they? Skin boosters are basically what they say on the tin. They're products to increase hydration or create intense hydration. So there are different types of them. Skin boosters that can be just simple hyaluronic acid or pure hyaluronic acid, and also ones that have amino acids, and also ones that will have vitamins, etc. So essentially they're there to create intense hydration, and they're generally known as injectable moisturizers. So what is the difference between a skin booster and a dermal filler? And that is the golden question that everybody wants to know. Dermal fillers versus skin boosters. Well, dermal fillers, let's get into that first, are hyaluronic acid just like skin boosters, but they are called cross-linked. And cross-linked dermal fillers or cross-linked hyaluronic acid, they're tightly knit molecules that are bonded together closely. So there's a whole science behind it. So these ones are designed to restore lost volume. Any aging concerns such as hollowing, such as jowling, it takes care of that. It also takes care of contouring, so it can actually manipulate the shape of your face or enhances it. So if your lips are thin, it can contour your lips, it can give you a chiseled jawline, projection of the chin, the hollowing of the eyes can be filled by tear troughs, a little bit of projection on the cheeks, and also it tackles the nasolabial. So there's a lot of benefits to dermal fillers. However, they're not skin boosters. Skin boosters are primarily for hydration, and they work on the integrity of the skin to increase elasticity, to increase buoyancy, hydration, textural changes, all of those fine lines and wrinkles. These are what skin boosters tend to do. So there is a distinct difference between skin boosters and dermal fillers. So are there any side effects to skin boosters, or any sort of contraindications, or anything that we need to watch out for? Like everything, you've got to have a risk assessment, even with skin boosters. But if you compare skin boosters, the risks of skin boosters to the risk of dermal fillers carry a higher risk because they can carry the risk of vascular occlusion. And what that means, it can block a blood vessel. So, that's from that sense, skin boosters are less risky. Plus, dermal fillers can have all sorts of other issues, such as delayed onset nodules, granulomas, all sorts of complications that can arise from dermal fillers, including unmet expectations. So that's also really something that we don't really talk about much. We just talk about the big ones like, vascular occlusion, onset nodules, granulomas, etc., but we never really talk about unmet expectations. People may have gone to get a treatment done, but then they find out actually it's not what they wanted or what came out, and maybe they weren't listened to, maybe what they had in their head according to their face that they have on social media doesn't fit their face. There are all sorts of unmet expectations and other sort of factors that will play into this. So when it comes to dermal fillers and skin boosters, dermal fillers will always carry a higher risk than skin boosters. Who are skin boosters for? Skin boosters are for anybody who happens to be a patient that is appropriate for the treatment. When it comes to the difference in age, for me personally, I will not treat anybody with dermal fillers under the age of 25, but that's a decision that I have made for myself. I will not treat anybody under the age of 25 for dermal fillers, but for skin boosters, yes, I would. So that is my case. Although the law says 18 and over, for me, I have made my own internal law, and I decided absolutely no way I would be treating anybody under the age of 25 with dermal fillers. Now, you may be wondering why I'm showing you this one in particular. Now, I've used so many skin boosters and all sorts of skin boosters, and I do love them. I love them because the majority of my work is about skin. So, of course, I'm going to be focusing on products that will treat the skin. I absolutely adore this one because it's not only a skin booster, it goes beyond that. It's actually a skin regenerator. So what you have here is not just simple hydration with regards to hyaluronic acid, but you also have other ingredients in there. So what this product contains is calcium hydroxyapatite, as well as the 3 fundamental amino acids, which are the building blocks of collagen production. So we have got the building blocks, the enhancers of elastin and collagen, as well as the intense hydration. So what happens when you actually get this treatment? Now, this treatment happens to be administered by 2 ml syringe, which you will see here, and then you have to have the treatment 3 weeks apart, 1 treatment 3 weeks apart, and thereafter you get a maintenance treatment. So if you have a look at the video here that I've shown you, which is of my beautiful patient, she's having a skin treatment. I'm injecting it through a needle in little papules, but I love doing it with a cannula. It has beautiful results, and it drizzles like honey. I absolutely adore this product. This is my favorite skin booster. Also, message and comment what's your favorite skin booster. Keep glowing and stay amazing.